Hello and welcome to the Weekly Shot. I'm RMZ, and today we're diving deep into the latest on GLP-1 medications, the blockbuster medication changing the way we think about weight, metabolism, and even disease beyond diabetes, from clinical trial shakeups to massive investments, from genetics and personalized medicine to unexpected benefits in dermatology. There's a lot to cover. Let's get started. Our first story: Eli Lilly has halted a trial testing a combination of bimagrumab, a drug originally designed to help preserve muscle, with tirzepatide, better known by its weight loss brand Zepbound. The idea was promising as patients lose large amounts of weight on GLP drugs. Some also lose lean muscle. Bimagrumab was supposed to offset that problem, but Lilly decided to pull the plug, citing strategic business reasons. It's a reminder that not every add-on therapy will succeed, even if the biology makes sense. Preserving muscle mass while losing fat remains one of the toughest challenges in obesity medicine. Still, it's a space to watch because multiple companies are exploring ways to fine-tune GLP-1 therapies for healthier weight loss. Hopefully, everyone is hitting their protein goals and getting in 3 days of strength training each week. Next, Eli Lilly is looking east. The company plans to bring its oral GLP-1 candidate, orforglipron, to India. In countries like India, injections aren't always practical. Needles can be a barrier for patients, refrigeration can be inconsistent, and access to trained providers is uneven. A once-daily pill solves many of these problems. If approved, this could put GLP-1 therapies into the hands of millions who might otherwise go without. It also marks a major step in global strategy, moving beyond wealthy Western markets and making obesity care more accessible worldwide. Back in the U.S., Lilly has just announced a $6.5 billion investment in a new biomanufacturing facility in Houston. This plant will create around 4,000 jobs and is designed to expand production of next-generation small molecule drugs, including oral GLP-1s. Why such a massive investment? Simply put, demand for these drugs is skyrocketing and supply chains are already strained. Building out capacity now is Lilly's way of securing its future in what has become one of the most profitable and competitive areas in all of medicine. It also signals confidence. Pharma doesn't spend billions unless they believe this market has long-term staying power. This investment is also on the heels of an announced manufacturing facility in the Richmond, Virginia area that was announced last week. That is a $5 billion investment expected to bring in 650 jobs long-term, on top of the 1,800 construction jobs needed to build out the facility. Now, here's a fascinating one. A new study from the Cleveland Clinic suggests that your genes may influence how well you respond to GLP-1 weight loss drugs like semaglutide and tirzepatide. Researchers looked at a gene called neurobiчин, or NBEA. They found that people with one version of the gene were 82% more likely to hit significant weight loss milestones, while others were nearly 50% more likely not to respond. That's a big difference, and it could pave the way for precision obesity medicine where doctors run a genetic test before prescribing, helping to predict who will benefit most. Of course, this is just the start. Lifestyle, environment, and other genes may also play a role as well. The idea that we might someday personalize obesity treatment the way we do cancer therapy, now that's groundbreaking. And finally, a surprising connection between GLP-1s and psoriasis. In a large observational study, psoriasis patients who were prescribed GLP-1 receptor agonists had remarkable outcomes. A 78% lower risk of death, a 44% reduction in major cardiovascular events, plus significantly lower rates of alcohol and substance misuse. Psoriasis is not just a skin condition, it's tied to systemic inflammation and higher metabolic risk. These findings suggest GLP-1 drugs might improve overall health outcomes far beyond weight and glucose control. It's early data and randomized trials are still needed, but it's yet another clue that these drugs may be more versatile than we ever imagined. So what do we take away from this week? Trial failures remind us that obesity science is complex. There's no silver bullet. Big global investments show pharma is betting heavily on long-term demand. Genetics research may usher in a future where treatments are tailored to each patient, and surprising benefits in conditions like psoriasis point to a wider role in GLP-1s in human health. That's it for this week's The Weekly Shot. Be sure to like, subscribe, and share if you want to keep up with the latest in health innovation. I'll see you next week.